हाँ, आनंद सबको भेज दिया लिंक। सिद्धार्थ। निहारिका, गुड इवनिंग।
Good evening, ma'am.
Nita జాయిన్ అవుతున్నారా?
Yes, ma'am.
And I feel very happy to be a part of this program, that is inaugural AP, a part of WIN. And at the outset, I would like to share one single thought. That is, recently I have come across a study in the West. That is, they have taken a cohort of middle-aged people and they have followed them up for 25 to 30 years and to see who has lived long. And after 30 years, they have interviewed the persons who lived long and they have assessed what are all the factors that made them live longer when compared to their other people in the same cohort. And interestingly, the facts that they have found is it is neither a healthy diet nor exercise. Of course, they do play an important role. What they have found is the most important thing that helps them to live longer is social integration. And the next one is the close relationships. The close relationships means they can share their joy, they can also tell their problems like that. So that is the core component of this WIN India as well as WIN International. And that is why we are here to share among ourselves our success stories, our problems, our challenges during daily practice, so that we can live longer to make our patients also live longer. And I hope AP also would be standing up to this. And without much delay, I would like to invite Dr. Hitaishi Madam, who is a senior consultant nephrologist in Tirupati. And I'm very happy to invite her because she is like a motherly figure to me. After I completed my DM, I came to Tirupati and she taught me everything apart from institute, how to behave in private practice, to deal with the patient in private practice. And every day, though she practices, she teaches us in every case what are the teaching points like that. So we can learn so much from her. And the other moderator, Dr. Uttaradas Madam, again, she's my teacher during my DM period. And she taught me all nephrology, research, and how to take patient care. Even in the adverse situation, she treats her patients in a corporate setup situation. So I'm very happy. And I invite Dr. Hitaishi Madam and Uttaradas Madam to take over the next session. Thank you, ma'am. Uttara ma'am. Ma'am, now we'll give the link to Uttara ma'am.
Okay. Hello, good evening, everybody. It's a great pleasure today that it is definitely because of this continuous pressure from Sanalata. She was right from the day I came here. She always tell you have to do the win. Hello. Yeah. So, and because of her, this is happening. Actually, she is the main organizer. I was very lazy in that. Somehow, then I told this Shiva Parvati, she was a continuous doing all the collecting the data of all the nephrologists. And surprisingly, we are having more highest women nephrology in India, I think, in AP. If I am not wrong, it is almost 32 or 33 women nephrologists are there in AP. So it's a great pleasure. Good evening to everyone. And as I think the Dr. Urmila Madam will explain all in details about what is the aim of this WIN and what is the importance and how it will help in our practice growing, our knowledge growing, And also, as Shiva Parvati told, that it will also give us a platform to interact. And hopefully we will do some offline CME. Maybe I can able to organize one in AIMS. It's a beautiful auditorium is going on. It's going to be complete very soon. So with that, I invite Hitachi Madam to say a few words.
Dr. Jiki.
Hitachi Madam.
Hello. Yeah. Good evening, all. We welcome you to the inaugural meet of AP Win Association. So now I call Dr. Jiki Madam, President of this AP chapter, to join me for the inaugural address by Dr. Urmila.
Thank you, ma'am. So we invite now Dr. Urmila Anand to give the welcome address for this AP chapter win.
Good evening, madam.
Good evening.
Good evening. Siddharth, can we start?
Yes, ma'am.
Anuradha Madam, good evening.
Good evening. Good evening.
Nice to see you, Madam.
See you quite a few of
No,
them.
I had some difficulty in connecting. So,
Oh.
Good evening, Dr. Anuradha. Good evening, madam.
good evening, ma. Good evening.
Good evening, ma'am.
Good evening.
Good evening, madam.
Good evening. Oh, Swarna, good evening. Where is Jikki?
I've been muted. Ma'am,
Hi,
very
Jikki.
good
How are
evening to
you?
you. Doing good.
Let me congratulate Hiteshi.
Madam, good evening.
Good evening, ma. Avunava?
Madam, can you start?
Gone, madam.
Urmila madam.
Yeah. So I think, can we start? Siddharth, can you mute everybody, please?
Yes, ma'am.
A lot
I'll
of
just
background
mute everybody.
noise.
Yes, I'll definitely do it.
Chalo. Professor Neela Prasad, Dr. Anuradha, Dr. Jiki, Dr. Hiteshi, and all the youngsters here. We start this meeting today, and I congratulate all of you to start the Andhra Pradesh chapter. And I don't see Dr. Muthu Jayaraman. Actually, a state chapter started in Women in Nephrology in Tamil Nadu way back in 2017, when we had a small meeting, when Swarlata and myself had invited nephrologists from all over, women nephrologists from all over the country to visit us in Hyderabad. Following that, there were a lot of efforts made by many of us, Dr. Kumud Mehta madam and Dr. Anuradha madam, talking to our Indian Society of Nephrology. However, we were not very successful to have a woman in nephrology group. But Dr. Muthu Jayaraman madam went back and she started Women in Nephrology Tamil Nadu chapter. And you'll be happy to know that that chapter is continuously working, and they have a very strong group and they meet almost every month. And Uttara, they have more than 50 members actually. One of the largest women nephrologists in India, Solata is right, is Maharashtra, Tamil Nadu, Kerala, I think. The other ones. And then Telangana. So that's how it was continuing. And there were a lot of, Sonalata has been saying that we should do something for the youngsters, get them involved, get them into the regular platform of nephrology practice. But we somehow could not get our time and also not the money that we needed to start with. So it was always a pipe dream, but it never became a reality. Until one day when Dr. Muthu Jayaraman madam called me up and said, that one of the pharmaceutical companies is going to help us provide us Zoom links every month for our meeting. That's how we started. And we were fortunate enough to have the support of Lisa Curtis, who is the current president of Women in Nephrology, and also Dr. Liz Lightstone, who's a counselor for Women in Nephrology and counselor for ISN, and also Dr. Valerie Lakes, who's been a mentor to many of us. With them and with the help inauguration by the Telangana governor, a lady doctor by herself, we started our win. And we are almost going to be 1 year, as Manjusha will tell you. August, we have our offline annual meeting. And in this 1 year, we have done a lot of activities. We have got a lot of recognition and support from various quarters, including International Society of Nephrology. So I think we have started a modest, maybe a modest beginning, but it has to be sustained. And for sustaining this group, we need the youngsters to be there. Manisha, Manjusha, myself, and Swarnalata cannot be involved, and we will not live long. That's also there. So this concept of involving youngsters came, and we are in the process of getting youngsters into the platform. It also, as Shiva Parvati says, we are always there to help you with your problems and your integration with mainstream nephrology. But we want all of you to be part of nephrology. We want to give you the platform with our connections. Arpana Iyengar has already mentored 2 students. We can help you get into international meetings. We can help you for training. Rajiv Lochana, who's not there, she is also doing a PhD now. We are trying to get people involved, and we can get you a platform to present your voice. I know all of us are clinicians. I am also a clinician first. But I realize after almost 25 years of nephrology, that clinical work is one aspect. If you don't keep yourself abreast of your nephrology advances, your clinical work automatically suffers. I know Jiki here, she's there. She was so involved in getting all CMEs. I remember I traveled from Bangalore 20 years back when there was nothing, me and my daughter in a car. There was not even anything on the roads, and we attended a CME. So I am aware that all of you have a lot of enthusiasm, let's say enthusiasm or capabilities to project ourselves. So this is what the meeting is about. And I'll briefly tell you about the activities. Manisha is involved with the registry. The registry platform is ready. All you need is to put your data. And if you put the number of data, and you we want you to, your names in papers, we want you to be in platforms in various meetings, and we want you to support in meetings. Then Swarnalata runs the newsletter, with which you can contribute. It's also being noticed. Then we have Dr. Anupama from Karnataka. She has started our journal. It's called Indian Journal of Kidney Disease. We welcome you to submit whatever you have, small papers, like Rajiv Lochana is doing. She's a young nephrologist from Madras Medical Mission. She is doing a monthly, ours is a quarterly journal, quarterly series of PD cases. All of you contribute your data. We are just in the process of signing a business agreement with Medno for our journal. So the journal is going to get an internet, platform, and hopefully within a year or two, with Manisha and others' help, we will get some kind of indexing. Manjusha runs all the meetings, the whole meeting. She runs all the meetings, and she's responsible for interacting with many people and getting everybody on board. We have Dr. Arpita, Dr. Sonal, each one contributing, Dr. Shruti from their own way. So I want all of you, please. The AP chapter has been started, so you all can contribute and be part of our nephrology meetings. Like this year, we have consciously taken a decision to, we have our International Society of Nephrology 1-hour meeting. This year, we have decided the session will be Rising Stars of Nephrology. So there will be young nephrologists, one from India, one from England, and one from Africa or Latin America. I request you all to get involved in whatever way. Project yourselves, ask us, we will help you how to take care. So with this, I thank everybody, and especially my seniors, Dr. Neela, Dr. Anuradha, Dr. Vimla Madam, Dr. Kumud Mehta Madam, Dr. Nandita Chaudhary Madam, and of course, Dr. Muthu Raman for their blessings. I was privileged to know Dr. Vidya Acharya. I knew her. Her family was involved. My husband also knew them. And I knew that enthusiasm that she had. And Dr. Anuradha Madam will tell you every time in meetings, she used to say we should have a women in nephrology chapter in India. So I need all of you. We are now more than 300 plus to at least be together, integrate with mainstream nephrology, and show what you are capable of. Thank you very much.
So much. Like showed us what we can do with WIN. And I invite Dr. Uttara Das Madam, who is Professor and HOD AIMS Mangalgiri, to have discussion of the council members WIN AP chapter.
It's a great pleasure to announce the council members. And it's like, it's not this year, whatever the council member, next year it will be different. And it's like for 1 year. And we would like to accommodate everyone as much as possible. And moreover, I don't know most of them. So I asked this whole thing is chart is prepared by Dr. Shiva Parvati with the help of, with the guidance of Professor Jiki Madam and Hitachi Madam. So the chief patron is, of course, because of whom I am a nephrologist actually. She was my teacher. And I still remember in 1999 when I joined NIMS, and she was like treated like her daughter. And she is now Dr. Professor Neela Prasad Madam. She will be our chief patron. Okay. So next president, we are very happy to announce that president will be again Professor Jiki Madam, who is who has just recently, she retired, but she was constantly doing her nephrology. She's a stalwart of nephrology in women, I can say. Then again, vice president will be again Dr. Hitachi Madam, and the madam is, I don't think that Hitachi Madam, Jiki Madam needs any introduction, but again, Madam is also again a stalwart of nephrology, the early nephrology, I must say. She is the second batch, I think, from Osmania Medical College, and she is a DM. And she also, I remember, she was doing for few months or years in NIMS as a senior resident, and she's
Yeah, Uttara, please carry on. Others, can you mute yourself, please?
Yeah. I mean, that's what. So Jiki Madam is again, so Hitachi Madam again, she's practicing in Tirupati, again one of the stalwart of nephrologists in that side, in Karappa side. So Karappa, no, that is called Rayalaseema side. Yeah. So and she'll be our vice president. So we are so happy to have all stalwarts in our committee. And me, I am Dr. Uttara Das, and just recently I came from Telangana to just crossed to Andhra Pradesh. I joined as a professor in health department in nephrology in All India Institute of Medical Science, Mangalagiri, and they only made me secretary, but all the works done by all of us. So next will be your joint secretary will be again Parvati, Shiva Parvati. She is a born and organizer. I mean, I remember all our CMEs in Nizam Institute. She'll be always the main part. She's a very good quiz master. So we can have a lot of quiz organization, quiz program. So Shiva Parvati again, she did her DM from Nizam Institute, and initially she was working as assistant professor in Tirupati's SIMS, and then now she is doing a consultant nephrologist. She is a very academic, highly academic, and I want her to join in an academic institute, not in this. And I hope she will come somewhere inside here in AIMS. So that's the future. So next is our council member. Just Shiva Parvati, 1 minute. Shiva Parvati, I have to all the council. Yeah. Joint secretary. Then WIN. newsletter, e-journal. Again, it will be by Dr. Hitarsi Madam. And she put scientific program, she put my name, the Uttarada's name. That's a scientific program. Of course, we will do a lot of scientific program. Then executive committee member are Dr. Pavani. Shiva Parvati, will you tell them their details? Dr. Pavani.
Yes, ma'am. She is a practicing nephrologist from Tirupati, ma'am, Sri Krishna Hospital.
Then Dr. Shaivani.
She is a practicing nephrologist from Nandyal, ma'am.
And Dr. Bharati.
From Vijayawada, ma'am.
Bharati is my student, Vijayawada. Okay. Then Niharika also our student names. She's she's in Guntur.
Yes, ma'am.
I think she's Guntur. And will they say hi or hello here? Or
They
No, we have a separate session for them.
Separate session for them. Okay, then
Yeah.
Dr. Ratna Prabha.
She's from Visakhapatnam, ma'am. She's a practicing nephrologist from Visakhapatnam.
Okay, and Dr. Vani.
Madam is also from Visakhapatnam.
Vani is from Usmania, no?
Yes, ma'am. She did her DM from Usmania.
From Usmania. So very, very welcome to all our young counselor member. And as Urmila Madam is telling, a lot of good platform will be there for you people. I am very sure that Shiva Parvati will definitely one day will become a secretary of ISN. I am very sure.
Thank you for.
And then cultural, other is this executive committee members, these are only, no? And then cultural committee members are Dr. Shiva Parvati and Dr. Nagajyoti Madam.
She is also practicing nephrologist from Tirupati, ma'am. She did her Usmania Medical.
So with that, I introduced the council member of WIN Nephrology Epi chapter.
Thank you, ma'am. Thank you, ma'am. Dr. Uttaradas, ma'am. That's so kind of you, and I'm so happy that you shared so many blessings on me, ma'am. And now we will move to the second session. That is inaugural lecture by President WIN AP chapter. And to chair this session, I would like to invite the chairpersons, Dr. Neela Prasad, ma'am. She is a senior most nephrologist, and as a student in NIMS, I always listened about her, and I'm really thankful and I'm happy to see her today in live. Because my professors used to tell she knows everything about dialysis mission. She can open and she can fit it again. So that much confident about dialysis. And she, they always used to tell you missed her teaching. So today I'm so happy to see her. And Dr. Muthu Jayaraman madam, if she is here, and she's senior most consultant from Chennai. And Dr. Srilata madam, I have seen her in so many conferences. Her students used to present almost the Thanker Awards. Presentation. She's professor and HOD of Department of Nephrology from Government Medical College, Kozhikode, Kerala. So over to you, ma'am, to introduce about Jikki madam and proceed for the presidential lecture. Thank you, ma'am.
Dr. Neela Prasad madam will start.
Neela Prasad ma'am, can you please join?
Actually, I cannot where that I have to introduce a speaker. Maybe you can do it because my voice also is not very good.
Okay.
Okay, madam.
Yeah. So,
sorry, voice is trembling very much. So maybe Shiva Parvati herself can tell on behalf of.
We have Srilata madam. She will tell about. Thank you.
Okay.
Yeah. Okay. Thank you, everybody. Good evening, everybody. First of all, I congratulate Dr. Jikki madam for being the president of the WIN AP chapter. And I know her personally during the last 10 years or so. She's a very good academician and very interested in taking up all the projects. And with these few words, I invite Professor Jikki madam for the inaugural address.
Over to you, ma'am. Jikki ma'am.
Yeah, thank you, all of you. It's so nice and heartwarming to see so many of our WIN people here. Good evening to all of you. Thank you very much for choosing me the president of WIN AP chapter. And I thought I will talk very informally about my incredible journey here. I have a few slides, but unfortunately I'm unable to share them. But all the same, this is going to be a very short talk only. My interactions with all the women in nephrology that I came across in my journey. I was born as a third daughter in a middle-class family. We were only 4 girls. My mother was interested to become a doctor, which she could not become. And she was my first inspiration. Can you hear?
Yes, ma'am. Yes, ma'am. We can hear.
Yeah. And 3 of us sisters later became super specialist doctors, with one person became a PhD in forensic science. I soon got married to Dr. U. Srinivasa Rao, gynecologist, and moved to Kurnool in AP and entered a joint family, and also had to learn a new language, Telugu. My daughter was born soon, and she was barely 5 weeks old when I started my MD PG course. Mind you, those days we did not have maternity leave for the PG students at all. My mother-in-law was a fine lady and she looked after my daughter so that I could look after my studies. I entered my AP government service in 1985. Passed my MD course. I pursued my MD course as on extraordinary leave for study purpose, and then completed in 87. And I remember Anuradha madam had taken a few classes on nephrology when I was a PG student. And after 1 year of working in periphery, I joined as Assistant Professor of Medicine, Kurnool Medical College, 1988. And my second child, my son, was born in 1990. Then one fine day, something happened. I slipped on the ramp of the Government General Hospital of Kurnool, sustained the fracture of a left second metatarsal bone in 1996 and was advised rest. At that time, my husband encouraged me to prepare for DM entrance, although his choice was cardiology and many friends suggested neurology. But I wanted to learn nephrology because nephrology was a gray area for me as a physician. And thus began my journey in nephrology, actually a fracture that led to a great leap in my life. Actually, I got a seat in both Tamil Nadu and AP, but my natural choice was Usmania Medical College, Hyderabad, because it was closer to Kurnool and I would get my salary as well. So at Usmania Medical College, it was a great learning experience with stalwarts, Girish Narayan sir and Anuradha ma'am. Particularly, I recall that Anuradha madam encouraged me to go to Kurnool to be with family at least fortnightly. And later, madam had given me this opportunity to give a guest lecture as a junior nephrologist on the topic of rapidly progressive renal failure in the southern chapter at Tirupati in 2002. And she had been a beacon of so many young and junior nephrologists in the combined AP. Also, madam had helped me in many difficult situations in personal life also. And thank you so much, Anuradha ma'am, for this. I recall an incident that a young girl of AK, about 12 years, about the same age as my daughter at that time, whom I had pricked a few times for the purpose of access. And she asked me this question: would you like to poke your child this way? See, this was very disturbing to me, that I decided to learn an invasive procedure perfectly and also do it with compassion and inflicting minimal pain to the individual. Madam Aruna would chide me and also guide me affectionately like an elder sister. Dr. Hitayeshi, my roommate, used to be very cool, even in those days. Dr. Sarnadatta, pathologist from Apollo Hospital, had taught us nephropathology and gave a good foundation. And I've had a very pleasant association with Dr. Manisha from my DM days, and she's really a brilliant person. I came back to Kurnool in 1999 posted as assistant professor of nephrology. And now I got a third child, an adopted child, my department of nephrology. In Kurnool, I've organized many CMEs. I had a few pictures to show. The first CME in 2001, I had invited all my teachers and good associates from Hyderabad, where they were all kind enough to come to Kurnool and bless me. And for the CME in 2003, as Dr. Urmila Anand recalled herself, that I had invited her to give a guest lecture, and she came with a small, cute breastfeeding child and showed her commitment to both academics and family as well. And to this date, Urmila Anand remembers this incident, and hats off to her for that. I've had a jolly time and learning experience with Neela Prasad Madam, Muthu Jairam Madam, Dr. Srilata, Dr. Uttara Das, and many others in many conferences. Dr. Manjusha had been a teacher to my son and shaped him to be a nephrologist now. I appreciate Dr. Swanalata Guditi for her interest and commitment in not only the cadaver transplant program, but also in establishment of the WIN organization here. I've had a few memorable interactions with the late Dr. Srilata of Guntur. She had been a pioneer in transplantation in AP, and we miss her to this date. Dr. Saivani, Dr. Sailaja, and Dr. Sarad Jyotsna have contributed to the development of our department here. Now we have a transplant program and also 2 DM seats sanctioned since 2020. Along with these people, Dr. Kirti Reddy, Dr. Sai Harisha, and many others have helped me organizing the annual conference of the AP Society of Nephrology on a virtual platform in 2021 successfully. And after being additional DME and principal, Kurnool Medical College for 1.5 years, I retired by superannuation on 31st May with a feeling of fulfillment. All the women in nephrology who had been part of my journey, say Dr. Aparna, Dr. Anita, Dr. Bharati, Dr. Pavani, Dr. Shiva Parvati, and many others. Probably I'm unable to name many of them here, but their contribution to my journey has been a wonderful experience. Now I'm back to my family and personal life with a new turn in my journey. And I'm sure each one of you will have a story of your incredible journey as well. And thank you very much for the patient hearing. And as has been put by Dr. Urmila Anand, we are all fading stars now. And it is the juniors who have to take up the torch and keep it burning. This urge in you. So many ladies are there in many states, and in our state also now we have the WIN organization, so that we will keep our beacon brighter. Thank you all of you for the patient hearing. And Madam, especially Anuradha Madam, Dr. Muthu Jayaraman, and so many senior who have joined the meeting to bless me in my second journey to go on. Thank you all.
Thank you. Thank you, Dr. Jiki, for the wonderful journey as a nephrologist. I come from Chennai and bring greetings from the WIN DN chapter to all of you. Thank you for inviting me to this function. It's a great event, and I congratulate the council members, all of them. Particularly Dr. Jiki, I know every meeting, every conference we used to meet and have chat, both about personal life and as well as professional life. Congratulations, Dr. Jiki. I know you will take
Thank you so much,
nephrology
madam. I need your
guide
blessings.
forward very nicely. You are a very enthusiastic person. And I always find that women nephrologists of Andhra Pradesh are extremely powerful. In my experience. Powerful means not as a gender or as looks or wealth or political affiliation. Powerful in knowledge and capabilities. They are extremely capable. This I witnessed because, as Urmila said, we as seniors were planning for a separate association as part of the Association of Women Nephrologists of India, but that couldn't materialize for many, many years. And we made a lot of efforts. But last year, the powerful women nephrologist of Andhra Pradesh, Dr. Anuradha, Dr. Urmila, Manesha, Manjusha, Swarnamala, all those people made it a reality. And not only a reality, they make it so vibrant, and the great works are done by them. It's really, really very admiring work by them. And it's the chapter, we were having a nephrology center, women nephrology meet every year for many years in Chennai. Uh, and that was made into Tamil Nadu chapter. And after it became a Tamil Nadu chapter of Win India, I could see the amazing changes and lot of youngsters with enormous work and presenting papers, talking, giving talks. Excellent reach out after it became a Indian chapter. And I'm extremely happy to know that AP is also starting a chapter, and every state must start a chapter, because that way you can reach out to all the women nephrologists in every nook and corner of our country. As you all know, women, as women Jiki described just now, and we as nephrologists, we are very hardworking. Otherwise, you would not have become a nephrologist. And intelligent wise also, we are above the average. And but in spite of that, we have other responsibilities in our life, like family, education of children, and work, and us also the breadwinner. So in this milieu of activities, responsibilities, our academic interest becomes a little backward, and we don't give a space to that. That is one reason very many of the national meets, international meets have very few women nephrologists. And understanding uh, by creating chapters in every state, and the main association as a Win India with the chapters can do a lot of work in reaching out and bringing out these women nephrologists in various corners of India, bring out, give them the facing their challenges, give them opportunities to present and bring out their activities, etc. And also there are some women entrepreneurs in nephrology. In Chennai, we have two ladies, women having their own nephrology center. I think Itashi is another example. And we must encourage that also. That's my wish. Besides conducting annual conferences, scientific meets, Women Nephrology, Win India and Win AP chapter must do these activities in bringing out the talents of all women nephrologists in India. With that wish, I congratulate Jiki for her excellent, and she's always very forward and very smiling, courageous lady. And under her chairmanship, I'm sure the AP India will, AP Win will become a big force to reckon with. And I also want Win India to become a great force and unique in its activities with all the brilliant young nephrologists, as Urmila said. I thank you again for this opportunity.
Thank you, ma'am. I think that's a brilliant message, both from Jiki madam as well as Muthu Jayaraman madam. We have Sometimes we always feel that we have children, we have family responsibilities. Even when organizing these meets, Vanlata madam used to call me daily. One day I said, madam, I am very busy. I have 2 kids. One is 2-year-old. I have to drop her in the nursery. Then madam said, do you think we are not busy? This is for you only. How to organize things in that busy schedule only, we want to teach you. Then okay, I said I have to make it, and then I started calling everybody, and I'm really very happy. Thank you so much, ma'am. And now we will move on to the next session, that is academic session, which is going to be on changing spectrum of biopsy-proven kidney diseases, 3 decades of single-center experience. And to chair this session, I would like to invite Dr. Uttaradas Madam, Professor and Head, AIMS Mangalagiri, Andhra Pradesh, and Dr. Swarnalata Madam, Additional Professor and Head, Unit, Nephrology Department, NIMS, Hyderabad, and Dr. Arpita Rai Chaudhary Madam, who is Professor of Nephrology, IPG, Kolkata. Thank you, ma'am, and over to you.
Okay. Good evening, everyone. Okay, this Srinivas is there. Srinivas is there, the speaker?
Yes, ma'am. Yes, ma'am.
Okay, good.
I'll start sharing.
This is actually, this study begins, I think, when I joined in 1999. I still remember, so madam is there, Neela madam. They first they asked me to collect all data, and under the guidance of Professor Dakshinamurthy sir and the Neela madam, there's a habit to collect all data. It has to be.
Madam, we could not hear you, ma'am.
Shiva Parvati, you were able to hear. It's problem with at your end.
Yes, ma'am. Yes, ma'am.
Can you hear me now? Can you hear me? Okay, so it is our job to collect the data. So right 99, I joined NIMS, and before that, when the department started, I think it's 88. There's some data, but I got the data from 1990. That those data are actually collected by Professor Neela madam. So with that, we started that collection of data and analyzing our data of biopsy. Retrospectively, I started from 99, and prospectively from 99 to till I left, and now this legacy is going on. So we are having data from 1992 till 2020, and this is a very interesting. When we have seen, I have presented this data in many conferences, and we have one publication also in 2010. We had a publication of biopsy-proven kidney disease of 20 years at that time. And now now Dr. Srinivas is doing a changing pattern. Is there any changing pattern of the biopsy of these 3 decades? So that's going to be a very interesting finding. So I welcome Srinivas to present his presentation.
Yes, ma'am.
Okay, Dr. Srinivas is a final year DM student of Nizam Institute, and he's a very active person. He's a final year, his exam is there. But thank you very much. In spite of your exam preparation, you are coming here and presenting your data. Well, congratulations, Srinivas.
Yes, ma'am. Ma'am, am I audible, ma'am?
Yeah, audible. Yeah.
Yes. Good evening, everyone. Thank you, Win India and Andhra Pradesh chapter for giving me a chance to present my study. The study is changing spectrum of biopsy-proven kidney diseases over 3 decades. Over the 3 decades from the Department of Nephrology in Nizam's Institute of Medical Sciences. During the course of my talk, I will be discussing the study under these 4 sections: introduction, aims, objectives, results, and conclusion. Coming to the introduction of the study, in 2017, the global prevalence of CKD was estimated to be around 9.1% of the world's population, with diabetes and hypertension and glomerular diseases being the most common cause of CKD. Similarly, in 2012, Indian CKD registry report showed that glomerular diseases were the major contributor of CKD next to diabetes mellitus and chronic kidney disease of unknown origin. What is the use of these epidemiological studies? To evaluate the spectrum of kidney diseases that led to chronic glomerular nephritis and chronic kidney disease, to for the purpose of improving patient care, disease prevention, and public health interventions. As if now, there is no proper registry in India to estimate the true burden of biopsy-proven glomerular disease. These studies, these epidemiological studies also might uncover new insights into the relative importance of genetic and environmental influences on glomerular disease epidemiology. Coming to these are the most 7 common presentations of glomerular diseases which I had done during my study. Asymptomatic urinary abnormalities, macroscopic hematuria, nephrotic syndrome, nephritic syndrome, rapidly progressive renal failure, acute kidney injury, and chronic kidney disease. The main aim of the study is to analyze the clinical presentation of biopsy-proven kidney diseases over the last 3 decades, to analyze the histological lesions in biopsy-proven kidney diseases over the last 3 decades, to analyze if there is any changing pattern of biopsy-proven primary and secondary glomerular diseases over the past 3 decades. It is a retrospective study done in the Department of Nephrology from Jan 1991 to December 2020 with a sample size of 3,891 biopsies. Repeat biopsies from the same patient for any reason had been excluded if there was it was the same diagnosis. Allograft kidney biopsies have been excluded. Biopsies which are inadequate for opinion were also excluded from the study. Coming to the results, these are the total number of biopsies, which were 4,964. The number of biopsies had increased annually from 1991 to 2020. There are around 4,964 biopsies, out of which 3,891 have been included in the study and 1,703 biopsies were excluded from the study. And the biopsies which had been excluded were gradually increasing in the 3rd decade. Probably the reason is increase in number of allograft biopsies and the number of repeat biopsies to assess the to look for any repeat biopsies which have been done for looking for histological remission or to assess the chronicity for continuing immunosuppression or stopping immunosuppression. And you can see the number of biopsies, inadequate biopsies, had been gradually decreased from decade 1 to decade 4, probably increasing user. Now for the last 2 decades, it had been a common practice that biopsies are being done under ultrasound, real-time ultrasound guidance using automated biopsy guns. Earlier, it was used to be done by unit anatomical landmarks or using IVP. Coming to the demographics and proportion of diabetes mellitus, age of the population who underwent renal biopsy had gradually increased from decade 1 to decade 3, consistent with the increasing aging population, and it was significant. It was male preponderance in all the 3 decades. And the number of patients with diabetes mellitus who had underwent renal biopsy had also significantly increased over the last 3 decades. The reason probably is secondary to increasing in the incidence of patients who underwent renal biopsy with diabetes mellitus and the number of patients, the increasing tendency to do biopsy in diabetes mellitus patients to look for non-diabetic kidney disease. Coming to the pattern of clinical presentations, the 7 presentations which I was discussing, nephrotic syndrome and nephritic syndrome remains to be the most common indications for doing renal biopsy in all the 3 decades. And you can see, but there is the nephrotic syndrome, even though it is the leading cause in all the 3 decades, the percentage of patients who are undergoing biopsy had significantly decreased from 1st decade to 2nd decade. And the number of patients who underwent renal biopsy for acute kidney injury and chronic kidney disease had also significantly increased. The number of patients with AK and CKD had increased. Although nephrotic syndrome being the most common cause, the incidence of patients who undergone renal biopsy for nephrotic syndrome had significantly decreased. Coming to the clinical presentation versus histological lesions in all the 3,891 biopsies, minimal change disease is the most common cause of nephrotic syndrome, which constitute around 25.3%, and FSGS and membranous nephropathy are the 2nd most common cause of nephrotic syndrome. Lupus nephritis is the most common cause of nephritic syndrome in our study, and PIGN is the 2nd most common. And acute interstitial nephritis and acute tubular necrosis are the most common presentations, are the most common histological diagnosis in the patients who underwent renal biopsy for AKI presentation. And in RPRF, post-immune glomerulonephritis and lupus nephritis, these are the most common causes of renal biopsies in patients who underwent the renal biopsy for rapidly progressive renal failure. And in chronic kidney disease patients, CGN and chronic glomerulonephritis and chronic tubular interstitial nephritis are the histological diagnosis in patients who underwent renal biopsy. And next to CGN and chronic tubular interstitial nephritis, 11.4% of the patients who underwent renal biopsy for clinical indication of CKD were IgA nephropathy. And in asymptomatic urinary abnormalities who underwent renal biopsy, 16.4% were acute interstitial nephritis and 12.3% were post-immune glomerulonephritis. And in hematuria who underwent macroscopic hematuria, who underwent renal biopsy, 51.6% of the patients were IgA nephropathy, being the most common cause, followed by diabetic nephropathy. Coming to the changing pattern of histological lesions over 3 decades, MCD is the most common cause of biopsy-proven glomerular diseases in the first decade. 18.3% of the patients who had underwent renal biopsy in the first decade were MCD. And second decade, it was lupus nephritis. And in the third decade, it was predominantly membranous nephropathy. So in the first decade, MCD was the most common cause. Second decade, lupus nephritis was the most common cause. And diabetic, in the third decade, membranous nephropathy was the most common cause. MCD, the incidence of MCD had gradually decreased from first decade to third decade from 18.3 to 7.2. It was statistically significant. It has decreased from 18.3 to 7.2. FSGS had remained stable. Even though it is one of the leading cause of biopsy-proven kidney disease, it had remained stable over the 3 decades, 9.6, 11.8, and 8.9%. Coming to membranous nephropathy, 6.4% of the patients in first decade, in third decade, it was 12.5%, which was statistically significant. IgA nephropathy had also statistically increased from 2.7% to 7.3% over the 3 decades. MPGN and post-immune were stable in all the 3 decades. Lupus nephritis is one of the most common cause of secondary glomerular diseases, but it had remained static. 11.7, 14.9, and 11.6. There was no statistical increase or decrease in patients who underwent renal biopsy with lupus nephritis. Diabetic nephropathy had increased from 1.0 to 5.9%. And patients with chronic tubular interstitial nephritis had also increased. Statistically, chronic tubular interstitials and acute interstitial nephritis had increased significantly from first decade to third decade. These are various studies which have been done across India in various occasions. You can see when compared to in the first decade, a study done by Dr. Chug et al. From Chandigarh and Date et al. From Vellore from 1982, in the initial decades from 1980 to 99 until 2085. MCD is the most common cause in India, which was similar to our studies also. It was the most common cause, MCD. Any study which had been done before 2000, most of the biopsy-proven kidney diseases were MCD. And coming to the third decade, and this was study done by from Rathiam et al. From Chandigarh. It was 24.4% in the third decade. And Mittal et al. From 2016, membranous nephropathy was 14.2%, and Dunlapan et al. Chennai, it was 9.3%. And the membranous nephropathy frequency across various parts of the country had also significantly increased, similar to our study, which was 12.5% in the recent years, in the recent decade. And the IgA nephropathy had also significantly increased, and the patient with a study done from Vijayawada, 15.1% patients are diagnosed to have membranous nephropathy, and a study from Delhi had also shown that 15.1% were IgA nephropathy. This is one of the most common, second most common in patients who underwent renal biopsy from 2010 to 2018. And in our patients also, IgA nephropathy is the third most common cause of biopsy-proven kidney disease in the third decade. These are also various studies across the world. And here also you can see various studies which have been done in across the world, mainly in the Asian countries, the frequency of membranous nephropathy had significantly increased in the last decade, along with IgA nephropathy. Earlier, IgA nephropathy was the most common cause of glomerular diseases in patients who underwent renal biopsy in the Asian countries. And along with that, now membranous nephropathy had also been significantly increasing, probably secondary to industrialization. Nephrotic syndrome was the most common clinical indication for biopsy in all the 3 decades, with significant increase in AK and chronic kidney disease patients undergoing renal biopsy. The frequency of membranous nephropathy had significantly increased. The frequency of minimal change disease had significantly decreased, might be due to changes in indications for performing renal biopsy. Proportion of patients with IgA had increased in particular in patients who had asymptomatic urinary abnormalities significantly over the last 3 decades, may warrant the need for routine screening with urine microscopy in children to detect the stage early. Diabetic nephropathy is increasing significantly, probably secondary to true incidence, and changing in biopsy indication to look for non-diabetic kidney disease. Lupus nephritis was the most common cause of secondary glomerular nephritis, much higher. In our study, it was much higher than any other study in India, which is almost in all 3 decades, it was more than 10%. Coming to the limitation of my study, it is a single center retrospective study. Even though a tertiary care center, the study group may not represent the entire population who had presented to us. Electron microscopy as a routine was not done in all patients who underwent renal biopsy, which might have changed the spectrum of these kidney diseases. The changing histological classification over the last 3 decades is also so that the earlier many diseases from MPGN and mesangial nephropathy, now they have been reclassified into C3 glomerular nephritis and IgA nephropathy. That changing histological classification, and earlier in the first 3 or 4 years of 1990 to 94, IF was also not routinely done in all patients. Probably these are the limitations in my study. Thank you.
Thank you. Yeah. Please, Dr. Arpita and Dr. Hi, Arpita.
Yeah, hi, Uttara.
Yeah.
It's again nice to
Welcome,
see you.
welcome. Yeah, welcome to this epi session. And I request you and Janarata to give your opinion, comment.
May I start, Shanalata?
Yes, madam, please.
Yeah. So a very nice presentation by Dr. Srinivashan, which is actually stake of many leaders of WIN, and so happy to see the whole data in a horizontal chart and spread over, and giving you a right impression about what is happening and look into the causes why it is happening. So the first thing I have noted in this 3 years, that is the attitude for biopsy that have changed in us, in nephrologists. We are doing more biopsy. In our biopsy threshold has come down. Therefore, we are getting earlier cases. I was looking at the Susina's presentation in last main meeting. I've looked at it and SGPGI also, and looked at our published biopsy spectrum in 2013. And I find even the regions are different. I find absolute similarity with Hyderabad presented data. MCD is the commonest presentation, which is now being surpassed by FSGS and other lesions, particularly membranous nephropathy coming up. The more diagnostic expertise, the more early biopsy probably is picking up IgAs more. Still now we are yet to exceed that 7 to 8% across India. Only 1 or 2 study from Delhi and around is showing 14%, though we expect that IgA will be more, but I here find that all our biopsy analysis over years is quite identical with what Hyderabad presented here. A very nice presentation, nice to find out that lot of CKD and AKI patients were biopsied, and CKD among the CKD, IgA stake has been clearly identified. Many times I have thought that what percentage of IgN patients are representing as CKD should come out from all region. I am doing an analysis, and I am happy to find that the one state had already done it on board, that around 11% of CKD patients are actually IgN at presentation, whom we usually identify in the post-transplant phase as, and we cannot differentiate because the native kidney biopsy was not in hand. And ATIN and CTIN identification on biopsy definitely would enrich us to look into the region-based causes. I'm so happy to see this chart that this can lead to preventive intervention, that what are the causes of ATIN, making the public conscious about it. Thank you, the Hyderabad team, for presenting it. And I'm so happy to be on chair and looking at the analysis of the data. Over to you, Sharnalata. Congratulations for preparing this.
Yeah, thank you, madam, and good evening to all of you. It's been a very great moment for all of us, particularly the WIN India. We have another edition of the AP chapter into our WIN India journey. So I really thank you all, the WIN AP chapter and the executive members, Neera Prasad madam, Jikki madam, and then Hitaishi madam, and all the executive members for a wonderful job. So I think it will take it forward, and then we'll have a very great session in the coming days. So coming to the basically, like, we should already, appreciate the seniors who have gone through a lot of difficulties and challenges to establish the nephrology as a department, particularly with respect to women. So it was very heartening to see the journey, incredible journey of Jikki madam. So somehow there is a loss of the connect between the seniors who have struggled and the juniors who have already, we have the institutions they face difficulty in just completing the course and then, trying to do their routine activities. So we can imagine how difficulty they have, come across during the initial stages of establishing the nephrology, particularly with respect to women. So basic idea of having this is to bridge that gap, showing the juniors that how it is difficult for the seniors to go through that phase and then establish, and is also a motivation for them. So something like a bridging the, the seniors and the juniors. We, the middle age, I think we are the right people to pull everybody together, the seniors and the juniors. And the second thing, as a woman, we have also crossed through, we are just passing through that middle age. What we have realized is, like particularly when we finish when the peak of our academic the journey, and then as well as the personal journey, when the reproductive women, the life, when the family life is at its peak. So we somehow, after completing the family, we have a child, and then we come back, we see that we are lost in the our academic this one. So it's very difficult to catch up, and then we somehow remain backseated. So that was another reason to pull this youngster batch. That's what I've been telling the youngster, that you don't get lost to yourself, that we are busy with all our kids or family. That's there with everybody. So still people are struggling and then to come up. So this is a platform for you. So we never had this platform. I think juniors should realize and then come forward. So I really sincerely request all of you to please use this platform to, it's for you, and then you should make use of this at maximum. We are something like we are in the passing phase, and probably after a few years we won't be there. So that's one thing. And second thing, what we had emphasized regarding the data is like, though initially we didn't wanted to have a data from the Hyderabad, this is a Hyderabad data, but of course it was done by Uttara. She is now the member, a council member of the AP chapter. But subsequently, I think it would be nice to have a data from the AP, the academic data, rather than the Hyderabad
Next
data.
meet, we'll present our data, although I am also retired.
Yes, ma'am. We didn't want to pressurize you. We wanted to make it a very informal, so that people can come forward and they don't run away. That was our intention. So the second time, probably from second, the session onwards, we can have a AP data.
Definitely.
AP
Actually,
data are there, and then we have education institutions, so we can always come up with your own data.
Yeah.
And the third, coming to the data, I think Madam has spoke extensively about the changing scenario of the kidney diseases, and then more early biopsy being done and IgA nephropathy is coming up. This changing the scenario of the nephrotic syndrome. Previously to see a minimal change, now it is more of a membranous. And we are also able to look into the various the etiologies of CKD because more biopsying are being done. And even the AK also, previously we never used to do a biopsy, now we are doing the AK also biopsy. So we find that there's an underlying glomerular disease which actually presenting would be an AKI. So we can also look at what is the risk factor of the AKI being progressing into the CKD. So we are getting into a lot of the etiologies, pathophysiology, and various options for the treatment basing upon the molecular etiopathogenesis. So it's a lot of things in the future nephrology I see. So with that, I would like to once again congratulate all the council members of the AP and hope this will take off with to a newer heights or with flying
Thank
colors.
you, Sanata. Thank you. I just want to add a few 2 points about the Srinivas presentation and what Dr. Arpita is telling. So what happened actually, these are all happening because of the manpower. In the first decade, there's only madam is there, and I now face that, and I now understand that what is the difficulty to start a department alone. Okay, that I understand Jiki madam's pain, everything I am understanding. It is not a plate from it's not a golden plate is giving to me here in AIMS, and I have to start everything from the scratching. And now I understand. Now, in the first decade, there maybe we are missing that IgA nephropathy because most of the time it was not IF was not there. But the second decade, when I also published, we have a publication on this in 2010. We published this data in Indian Journal of Nephrology, and that time only 2 data are there: our data and CMC Velo data. Means it decade wise. And what has happened at that time also, we have seen that IgA is increasing. But I don't know now how the Srinivas did that calculation, but the same data I'm also having, and I did a calculation and I found that the IgA nephropathy is around 15%. And also the Kerala data, there's a data from Kerala and Karnataka. It was done maybe a few years back, and Tamil Nadu. Everywhere they are showing the highest number of IgA nephropathy. Even if I am not wrong, the Kerala is showing IgA nephropathy incidence is very high, around 24%. And now in AIMS, I've joined 6 months, but I'm doing a lot of biopsies. And last week we have done 10 biopsy, believe or not, 5 is IgA nephropathy. So the IgA nephropathy is hiding somewhere, and it is very much important that we need to tell the authority, the national health missions, to include that what the Japanese are doing, how to identify in the early stage of this IgA nephropathy, and that should be there in the that curriculum, like blind control curriculum, like worm control curriculum. Similarly, we should have that type of things. I mean, from within India, you can send that thing. But IgA nephropathy is very high.
I have published one paper in KIR, which I did through International Society of Nephrology, a school children screening of asymptomatic urinary abnormalities. It was SSKR data, and I published in KIR, and I have shown that it was it would have been good if we could follow them up longitudinally, but the horizon 1 point data, what I had presented, that also shows a significantly high asymptomatic urinary abnormality, along with many other epidemiological concerns in younger age group, like obesity, increasing obesity, which will further reflect as increased number of FSGS, as we are coming to know in these decades also, that FSGS is also increasing in an alarming proportion. More we are recognizing. So that article also can be used to put forward before National Health Mission regarding the recommendation of school health screening to include the asymptomatic urinary abnormalities.
Yeah, that's true. That's very great.
More than 11,000 patients.
Actually, this health where they are now
good
in
epidemiological data.
Yes. Epi, in this area, particularly the Krishna district and this district where I am there, and you believe not, the incidence of very high, the CKD, and somehow nobody, etiological study was done by many people, many stalwarts, but Exactly, the histological diagnosis was not there in those patients, and genetically. Why these people are genetically more prone to have this chronic kidney disease? So I think we in AIMS, our president is very much interested, and he is collaborating with some Michigan University. The Professor Rajan is there. I think his name is Rajan Professor, and he is actually, he's a visiting professor of AIMS, and he is very much interested to do this etiological work in Andhra Pradesh. And I hope that he will fund, the fund will get, we will get the fund from USA. So we hope that this will definitely clear many ideas, many darkness in our, because incidence of CKD is so high, you can't believe it's so high in this area. So that's my opinion. And the number of biopsies are increasing because of number of manpowers are increasing. Because we have 24 students. No, they have to do. Why we are doing AKI biopsy? Why we are doing so many CKD biopsy? In fact, biopsies are more in NIMS. So that is the thing. Because of everything, manpower, facility, all together, I think this pattern is changing. Thank you.
And
become more
change of
courageous.
also.
Madam Neela Prasad. Neela Prasad, madam.
Initially, we didn't have immunofluorescent studies. Why you take this routine totally? So immunofluorescence is second biopsy. Staying and identify, but still those days IgA was not identified, if I remember correctly. And Uttara Das has really done good job. She has collected all the biopsies right from 1990 till I have not identified. And I am interested that previously we used to think that FSC is common, but now people are saying that it is IgM problem. It's going into probably study. Then I want to ask Srinivas what is the study on diabetic nephropathy. He didn't say what did he find biopsy. Can he give me?
I think he will separately, we will do separate analysis of diabetic nephropathy's biopsy, madam. And you're right, madam. We started doing this because of constant pressure from you. We are always afraid of you if we don't present data in Saturday meeting, and we know what we will get. And that is the result. Now this is the result because of you and sir constant pressure on us to do the work and the presenting that Saturday meeting. These are all the result of presenting that Saturday meeting. Thank you, madam.
Yes.
Now you understand.
Yeah.
Those
To increase correlation of biopsy and data is that Saturday meeting. First you will give impression why we have the biopsy, and you will get the biopsy result. Then and there it will feel what we are doing, and that will really create a database for biopsy.
Yes, madam.
Interested biopsy even at AIMS Delhi. Uttara Das so even at AIMS Delhi, I used to remember he said
voice is not clear.
My data showed MP. So really it's a good presentation. So I congratulate all of you, and Uttara Das has given good decision, and Salat has taken up a very good topic for discussion today. Nice one.
Thank you, madam. Thank you. Uttara, can you move on to the next session, because
we can move
for the youngsters, so we have been eagerly waiting for them to express their views. Shiva Parvati, please carry on to the next session.
Yes, ma'am. Now we move to the next session, that is connecting WIN. This is an interesting session. We thought that we would introduce all our members to the WIN India as well. And because and to moderate this session, I would like to invite Dr. Manisha Sahai, madam. I think who needs no introduction, but I want to tell one word to Manisha, madam. I always feel short of words to appreciate you, madam, whenever you present in a public seminar, because I want to keep my style, but you are the only person whom I want to imitate, madam, whenever I go for some conference. And she's a professor and HOD, Department of Nephrology from Usmania Medical College. And next is Manjusha, madam, again one of my favorite madams, from whom I learned organizational skills, and I still keep learning how actively all these four women from Telangana are moving the WIN ahead. And Dr. Rajiv Lochana, madam, she's a consultant nephrologist from Chennai. So over to you, madam. And to present this, we have chosen 3 of the nephrologists from the state of Andhra Pradesh, and they would be telling about their colleagues, and they would be telling about themselves. First, I would like to invite Dr. Pavani, madam, who is a senior consultant nephrologist from Tirupati, from Sri Krishna Hospital. Over to you, Pavani, ma'am.
Yeah, thank you, Shiva Parvati. Am I audible to you?
Yes, ma'am.
Yeah. Okay. Good evening, everyone. Respected President Ma'am, Dr. Urmila Ma'am, WIN India, and JK Ma'am, WIN AP Chapter, and our senior professors and junior colleagues. Good evening, everyone. Warm greetings from Temple City, Tirupati, the spiritual capital of Andhra Pradesh. Myself, I am Dr. S. Pavani, consultant nephrologist here. I have graduated my MBBS from SV Medical College from 1999 to 2005. And I did my post-graduation in Department of Pediatrics in SVMC in 2010. And I have done DM Nephrology in Narayana Medical College in 2013. Since then, I have been practicing in Tirupati at Sri Krishna Super Specialty Hospital for the past 9 years. And today, I have been given the task of introducing our seniors and our fellow colleagues from our region. I am going to introduce from the region of Tirupati and Kadapa as a part of the program of Connecting WIN. There are 4 women nephrologists are there in Tirupati, and the first and foremost is, as you all know, Dr. Hiteshi ma'am. There is no need of any introduction to her, and I'll tell briefly about her and who is the stalwart of nephrology. And madam did complete her MBBS and MD Pediatrics from SV Medical College in 1991, and she did her DM and DNB Nephrology from Usmania Medical College, Hyderabad in 2001. And she has been practicing in Tirupati at Manasa Kidney Foundation for the past 2 decades. And there is no need of any special introduction to her, ma'am. And another member of our group is Dr. K Nagajyoti. She has completed her MBBS in the SV Medical College, Tirupati from 96 to 2002. And she did MD Pediatrics at Nilofer Hospital in 2004. And she completed DM Nephrology from Usmania Medical College in 2016. And she is practicing at Suguna Kidney Hospital at Tirupati, and she is also a consultant at the Sankalpa Super Specialty Hospital in Tirupati since 2016. And another active member of our team is Dr. K Shiva Parvati. She's well known to all of you, and she also doesn't require any introduction. And briefly about her, she did her MBBS from Dr. Pinnamaneni Siddhartha Medical College, Vijayawada in 2003 batch, and did her MD in General Medicine from Andhra Medical College, Vizag. And she did her DM and DMB Nephrology from Nizam's Institute of Medical Sciences in 2015. And since then, she is practicing nephrology at Tirupati at Pranavi Super Specialty Clinics, and also a consultant nephrologist at Amara Hospital, Tirupati. And another fellow colleague from Kadapa, Dr. G. Aparna. And she is practicing in Kadapa at their own hospital, Surya Hospital. And she did her MBBS in JSS Medical College in Mysore. She has completed in 2002, and she has done her MD Pediatrics from Siddhartha Medical College in 2007 and completed her DM course from Andhra Medical College, Vizag in 2013. Since then, she is practicing in Kadapa. And a few of our junior members are Dr. Maria, who is presently working as senior resident at SWIMS, and 2 postgraduates, women postgraduates are also there in SWIMS, Dr. Aishwarya and Dr. Martini. These are all the members from the Tirupati and Kadapa. And I thank the organizers and the chairpersons for giving me this opportunity. And I would like to actively participate in the further academic activities as well. Now I will hand over to Dr. Saivani, who is the nephrologist working in Shantiram Medical College, Nandyal, to take over and introduce the other members from Nandyal and Kannur. Thank you once again.
Thank you,
Dr.
ma'am.
Saivani.
Dr. Shiva Parvati, you can also ask them to briefly express their views, like how they would like to, how they feel that these opportunities be given to them and how they would like to take it forward. Okay,
Yes,
rather than just, only presenting the names.
Yes, ma'am. I request Dr. Saivani, madam, to introduce herself and her team and what are the future plans and how to take ahead this AP chapter win.
Respected seniors and President Madam Dr. P.N. Jiki, my teacher, and Dr. Uttara Das Madam, and other teachers, my mentor, Dr. Manisha Sahai Madam, and Swarnalata Madam, Manjusha Madam, Anuradha Madam. Now I am very much privileged to be a part of WIN chapter, and I am interested in preventive nephrology. I have so many plans to improve the preventive nephrology. Even my HOD Madam, Manisha Madam and Jikki Madam were very much interested in preventive nephrology. So I want to conduct screening cabs because renal failure patients will be having symptoms even at stage 4 and stage 5. So I am very much interested to keep the camps to detect hypertension, diabetes, and urine albumin, urinary proteinuria, so that we can decrease the morbidity and mortality. And I am also interested in transplant nephrology. I want to start our transplant program in our medical college, Shantiram Medical College, and which can be done at Arogyashri also. And I am from the region of Kurnool. We are 5 members in this Kurnool, the first person is our president, Dr. P.N. Jikki Madam, who doesn't need any introduction. She is my teacher in Kurnool Medical College. I was introduced to nephrology from her. After that, and she did her MBBS in Kilpauk Medical College in Chennai. Then she did MD in Kurnool Medical College, and she was completed DM from 1997 to 1999 in Usmania. And after that, she was the torchbearer of nephrology in Rayalaseema, entire Rayalaseema near Kurnool region. And she was the only one nephrologist available in our area for 15 years. And she was a professor and HOD of Kurnool Nephrology Department, Kurnool Medical College, and recently retired. And she has successfully completed her tenure with introduction of PG seats and also introduction of transplant at Government Medical College in Kurnool. Next is myself. I am Dr. Saivani. I did MBBS from SV Medical College, Tirupati, and MD from Kurnool Medical College, Kurnool, DM from Usmania. I am a student of Manisha Sahai Madam. And I did DM from 2012 to 2015. I have completed DM by 2015. Later, I have joined in Kurnool Medical College for 1 year. Later, I have joined in this Shantiram Medical College. Now, I'm the head of the unit in Shantiram Medical College, and we are doing decent work in Shantiram Medical College. We are doing all research work in acute kidney injury. We have presented papers on peritoneal dialysis also, and we are conducting so many screening camps in and around the area of Nandyal for screening kidney diseases. Next, our future plan is to to start the transplant unit at Shantiram Medical College. Next is I am very much honored to introduce my senior S. Sailaja Madam. She also did MBBS and MD from Kurnool Medical College and DM from Gandhi Medical College. She is a student of Manjusha Madam, and now she is practicing in SS Hospital, Kurnool. And initially she was worked in Kurnool Medical College under guidance of Jikki Madam for 2 years, and she was she has helped GK madam for bringing transplant permission in Kurnool Medical College. Next, I am very happy to introduce my juniors, Kirti Reddy and Sai Harisha. Kirti Reddy did MBBS from Kurnool Medical College and MD from NIMS, and DM also from NIMS. And she has completed by 2019. And now she is a consultant nephrologist at Sri Balaji Hospital, Nandyal, and also Udayananda Hospital in Nandyal. Next is Sai Harisha. She is MBBS graduate from Kurnool Medical College and MD from Kurnool Medical College, and she did DM from Andhra Medical College. Now she is a consultant nephrologist in Nandyal Critical Care Center and Harisha Kidney Care. And we five are from Kurnool region, and I am very happy to be a part of in this win. And thank you for giving me this opportunity.
Thank you, madam. Now we move on to Vijayawada region, and I request Dr. Bharati madam, who is a consultant nephrologist from Sai Bhavani Hospital, Vijayawada, to take over.
Am I audible?
Yes, ma'am.
Yeah. Respected professors, my dear seniors, my dear friends and colleagues, and good evening to all of you. Actually, it was a constant effort by Swarnalata madam to start this program from Women in Nephrology AP chapter. Madam used to call me for the long 7 months to start this program, take initiative, we have to start the AP chapter Women in Nephrology also. But because of lack of time, as already our professors and our seniors has told, because we are married, we have children, I too thought the same. I used to tell madam, I have no time, I have to take care of my children. So I used to give so many excuses to the madam for initiating this program. Finally, I only got guilty. Why madam is in spite of being pressurized by madam is taking this much interest. Why we should not take initiative and start the program? So along with Shiva Parvati and Dr. Uttaradas madam, we have started this program, and with our other seniors and other colleagues, we are planning to take this platform to more next level. Actually, I am I'm Dr. Bharati. I am from, actually my native place is Nandyal, from Kurnool district. I studied MBBS in Kurnool Medical College. There I have first seen the GK madam. I was first introduced to the nephrology by GK madam. In second year, when I am studying second year, there we have conducted a big medical exhibition in Kurnool Medical College. In that medical exhibition, we have all the stalls like nephrology stall, endocrinology stall, everything. In that nephrology stall, madam has put a dialysis machine demo and a person demo and what is the process of dialysis, everything, and each and every people got attracted to this that stall, and that stall has won the first prize in that medical exhibition. Then I came to know what is meant by nephrology, what is meant by kidney, because it was very initial stages. Just we completed our first year MBBS and we came into second year. At that time, medical exhibition was conducted. At that time, we don't know still the basics of clinical medicine. So I thought this is somewhat better. So Dicky madam was the first person to throw a light on nephrology to me. After that, I have completed my MD General Medicine from SV Medical College, Tirupati. There I have met Pavani madam. Madam is practicing at Tirupati. Madam came as senior resident where when I am studying MD General Medicine. During that period, madam used to tackle the acid-base balances very efficiently. I am surprised because by correcting the acid-base imbalances, patient used to recover very well. The prognosis of the patient was very better when we know, before we know the what is acid-base balance corrections, and that is difference. What made the difference in the patient? So that is also one inspiration for me to take the nephrology as my DM specialty. After that, actually, I am more interested in clinical nephrology. I like to see the patients clinically and make a diagnosis, clinical diagnosis, rather than depending on the investigations like that. So by seeing many of the cases while doing in MD, I thought, and I am very much interested in general medicine. So if I take nephrology, I can continue my general medicine. because we need not depend on other persons to get referral for our patients. Even malaria can cause AK, even CKD patients can develop tuberculosis. So the infectious part of general medicine we cannot leave. And all our CKD patients have cardiac problems. So still our cardiology cardiology subject also we can continue. And our CKD patients will be having seizures, CKD patients will be having all the neurological manifestations. So I thought, so to continue my general medicine practice and to improvise my practice, it will be better to take the nephrology as my DM specialty. So I have opted DM nephrology. And after entering into the NIMS nephrology department, it was very different for me because I did not work in the institutes before. I have studied in government medical colleges. So it was very different to work in the institute. We used to have every alternate day night duties, and every academic activities was very important in NIMS. In Karnool, when I am studying MBBS, that is different academic activities. In Tirupati, when we are doing, we have while MD we have activities, but not this much frequent. Because weekly we used to have 3-4 academic activities. We used to constantly present the journal clubs, seminars, clinical case presentation, everything. So we have to do the night duties and we have to do the day duties, and simultaneously we have to participate in the academics. So it was very tough for me initially, but with constant support of Dr. Rutra Das madam, Dr. Swanalata madam, we could manage successfully, and I have completed my DM nephrology from Nizam Institute of Medical Sciences. Though I have mentioned a few names like Jiki madam, Pavani madam, Swanalata madam, Jiki madam, indirectly Manjusha madam, Manisha madam, and all other Urmila madam and Hitaishi madam, all other madams indirectly through CMEs or through webinars, and Anusha and also have came for conducting exams like pre-clinical exams before going into final exams. There we also have exposure to Anuradha madam also. Madam used to ask clinical oriented questions like vivas, everything. So indirectly we have learned from all of you. So because of that only now we are able to practice in the private practice confidently, madam. Because without your support and without acquiring knowledge from you people, it would have been very difficult to tackle the patients in private institutes. Because working in institutes, I found working in institute is very difficult and different, and practicing private is very difficult. Because in institutes, so many people will be coming, and they will be not, and most of the people will be from Arogyashree, so they will be not focusing on everything. Means they will not catch each and everything. But when coming to the private practice, it has become very difficult to counsel the patients, because already they are coming, they are going through the internet, they are asking so many doubts. We have to patiently give them answer, and so different practice we are doing in the when we came to private practice. So because of all your support only, now I am confidentially doing my practice. And recently, actually, I am working, till now I have worked in Arun Kidney Center, Vijayawada, as consultant nephrology. Still I am practicing there. And recently, 6 months back, we have started our own multi-speciality hospital, madam, Sri Bhavani Hospital. It is located in Vijayawada only. And now I am learning the management also, madam, because managing the hospital is also quite different when practicing. Practicing is also different. So in different phase I am now, but with all your support, I think I can handle both my practice and my management skills and my family also. I am looking forward into that. And now I would like to introduce our nephrology colleagues from Vijayawada and Guntur zone. And first is Dr. Varalakshmi madam. She is consultant nephrology at nephrologist at Kartikeya Kidney Care Center, and she is also a consultant nephrologist at Paturi Medical College, Guntur. And next is Harita, Dr. Harita. She is a consultant nephrology at Sanjeevani Hospital, Guntur. And Dr. Niharika, she is a consultant nephrology at Dr. Ammaji Trust Hospital. And coming next is Dr. Vemuri Radhika. She is a consultant nephrology at Lata Super Speciality Hospital, Vijayawada. If any one of you are attending this program, you can raise hands that so that people can recognize you. Who is I am telling which person name. And next is Dr. Sai Swapna Madam. She is a consultant nephrologist at American Kidney Institute, Vijayawada. Dr. Sarita, she is a consultant nephrologist at Kamineni Institute of Medical Sciences, Vijayawada. Dr. Sirisha, she is a consultant nephrologist and associate professor at NRI Medical College, Guntur. Dr. Vishnupriya, she is a consultant nephrologist at Lingas Hospital, Vijayawada. Dr. Spandana, she is a consultant nephrologist at Centenary Hospital, Vijayawada. And Dr. Lakshmi Prashanti, she is a consultant nephrologist at Bhimavaram Hospital. So almost around 10 nephrologists are there from Vijayawada, Guntur and Bhimavaram zone. So I like all the members to actively, I wish all the members to actively participate in this WIN program. We would like to
Why did you didn't tell my name? I am also
madam, not but lastly is Mutra Des madam. Madam now has come to our zone. It is our privilege to have Dr. Uttara Das madam into our AP chapter, because till now madam was in Hyderabad. Now madam has come to AP chapter.
I am both in Guntur and Vijayawada middle.
Guntur and Vijayawada madam. And it is madam needs no introduction. She is well known to all. Under the guidance of madam, we will take AP chapter Women in Nephrology to the next level, madam. I am very sure of that. And I like to thank all of you for giving me this opportunity, Women in Nephrology India. And now I would like Dr. Niharika to share her views. Dr. Niharika.
Thank you, ma'am. Am I audible, ma'am?
Yes.
A very good evening, everyone. Today, I'm very happy to see all my teachers and seniors virtually after a very long time. And I'm Dr. Niharika. I did my MBBS from Dr. Pinamneni Siddhartha Institute of Medical Sciences from 2007 batch. Later, I did my MD General Medicine in Guntur Medical College. And I did my DM Nephrology from Nizam's Institute of Medical Sciences 2017. I just want to share my DM journey on this occasion. Till now, everyone have shared their how they developed passion or interest in the nephrology, but I will tell my story. To be frank, I opted my DM nephrology by chance only, not by my choice. That was a common entrance exam at that time. I opted for all non-interventional branches: neurology, nephrology, endocrinology, rheumatology in Usmania, Gandhi, and NIMS. But by chance, I got DM nephrology in NIMS. But later, I was very happy because after joining in NIMS, I have seen Dr. Smanlata ma'am, who is very multi-talented, and I have seen her passion and dedication in the patient care and student teaching, and her organizational skills are also very amazing. And coming to Dr. Uttara Das ma'am, she is very strict and she is very dedicated in the patient care, and she has taught us the importance of collecting data and the publications. And before joining DM, I never passed any central line also with the support of my senior Shiva Parvati ma'am and Kirti ma'am. Now I can say that I can pass central line very efficiently. I can do perm cath insertions also. And not even in the NIMS also, during our nephrology forums, I used to come across Dr. Manisha ma'am, Anuradha ma'am, and Manjusha ma'am, Umla Anand ma'am. After listening to all their teachings, it was a very inspirational journey to us. And I felt very happy that I took a right branch, and I'm very happy that by chance I got nephrology, but it was my passion. I can proudly say that. During our DM course, we have the guidance of our seniors and our teachers, but I miss all of them after coming out of NIMS because I have faced so many difficulties, and because I am currently working in a private hospital, I'm the only the nephrologist there, and I'm lacking so much of previously I was alone, and I was very worried how can I manage the patients, because immediately after passing NIMS, I came into the private practice, and it was a remote area also, like it was very periphery center. So I'm missing that guidance, and I'm missing my seniors and faculty. But I'm now very fortunate that we have the platform of WIN so that we can share our knowledge and we can discuss our problems, and virtually we can regularly see our seniors and our faculty so that we can't miss them. So regularly we can have all these meetings, and I can see all my seniors and colleagues. So we budding nephrologists are very fortunate enough to have the blessings of our senior faculty even after passing our DM exams. So I thank you very much, everyone.
So great listening to all of you, the budding youngsters of nephrology of AP chapter, having to know about your journey. Equally impressive and equally inspiring to all of us. The main aim of putting this session as such is how you can connect the WIN AP to the WIN India so that the WIN AP chapter can be taken forward. Since it's in the NA phase and in a nascent phase, we have also faced a similar situation. So we are here giving you a holding hand to take it forward in all the means and all the ways possible, as we had faced certain challenges at the outset. Like the strategy that can be proposed, as the president and their council members are here right now, is that probably as the executive committee is formed in full strength, as I understand from whatever Dr. Swanlata has given the information. So probably conducting, getting the registration of WIN AP chapter is probably the first step which the secretary can take care of. And also going ahead with certain monthly academic meetings, if not monthly, at least once in 2 months or once in 3 months, will keep you in a cohesive manner. And we'll also connect all of you in an academic platform so that, you know, as the last doctor has said, sharing the problems, case challenges, all these things can be discussed in a more versatile and in more lively way. And of course, connecting with WIN India is also crucial because you're part of us. So always be a part of the central WIN India team, because we have been conducting regular monthly activities in which we want to see your presence, both as speakers, as well as chairpersons, as well as audience. For this, you need to be active member. In fact, what we have, the WIN India activities have been so vibrant that, I mean, the scaling of certain milestones, like, you know, I mean, conducting meetings with the International Society of Nephrology, the participation from women in nephrology of the international standards, as well as establishing a website which is highly vibrant, and of course bringing in a newsletter and a journal at the outset itself have been challenges, but we have done that. But we want you to be part of that. It's for us, by us, and of us. So all the WIN AP members hereby please contribute to the central you know, newsletter, as well as the Indian Journal of Kidney Diseases editor-in-chief, Dr. Anupama YJ. So please contribute. I see so much of academic enthusiasm in the youngsters who have talked just now. So don't derail your enthusiasm in the academic lines. Please search for the cases, screening programs going on in Kurnool area and all these things. Please contribute to the journal so that your representation, your achievements are appreciated and of course applauded by everyone. Having said that, we are also conducting, as I said, monthly meetings. Please do attend them, because we have been sending the links to everyone through the WIN India mail, but you are requested to join. The other thing is the conference which is coming up in short, that is within 2 months, that is the WIN ICON, that is WIN India Conference 2022, which is the first annual conference of WIN India. So on this, we have an excellent scientific program which is coming up, done by the scientific chair, Dr. Manisha. So we have an inclusion of international as well as national faculty with wide versatile topics. So we all want the youngsters of yours, in case some of you are teachers or the teaching faculty, or in case you have junior faculty who are working with you, please encourage them to register for the conference, to register for WIN India, to submit an abstract towards the WIN ICON conference. This is a hybrid conference, as you all know. Minimal registration fees is there. Do participate, do submit your abstracts. We are all together, so share our achievements and share our works and share our passions together so that we move forward. So what we have done, what we have faced as challenges, we are ready to help you out. We will definitely hold your hands for you to scale further heights, but I'm sure you don't need us, because there are already giants in WIN AP, as Professor Jiki as well as Dr. Uttara Hitaisha, very seniors. They are seniors to us, so I mean, I'm sure they will lay down the way forward for you, but nevertheless, we're always there to help you. So since this is an interactive session, we want you to interact with us as you know, as you go forward. If you face any challenges,
few more people would like to talk. I mean,
yes.
Dr. Mani is there from Isaac, so I think
yes, Yes, I think they can speak. So just be in an interactive manner as to how you want to take it forward. We have other patrons also with us. Anuradha Madam is also here, who in fact had conceptualized the idea of Win India way back in 2013 and all. So we have seen all the way. So I think we are here to help you. So you want to share any thoughts of yours, please do that, so that this session is utilized in a more effective manner. Over to you, Swarnalata.
Hello, Swarna.
Madam.
I would like to put in just one word.
Yes, madam.
I am very happy to listen to, learn so many nephrologists from Karnool and Nandial, because as a child I grew up in Karnool. I was 9 years old when my father came to Karnool, and I love Karnool very much. And and also Nandial. Whenever relatives come, we used to go to Nandial to Mahanandi and Kalwa Bugga to see the Lord there. So I am very happy to learn so many ladies from Karnool and Nandial. Thank you for the opportunity. It's nice to learn about them.
Yes, madam. In fact, we were surprised, madam. We had around, we were thinking that we hardly are like 5 to 10 from the AP region. But when we collected the data, we were surprised it was 34 people, 34 women nephrologists across the Andhra region. So now we'll move on to the next region. We have Dr. Vani from Vizag. I would like Vani to, speak. Vani, please. Dr. Vani, please.
Good evening, all my respected teachers, mentors, and council members of Win India AP chapter, and my colleagues. I am very happy to see you all. Ma'am, Anuradha ma'am, Manisha ma'am, good evening ma'am. Dr. Swarnalata ma'am, I can say only one word. What I am is, now today what I am is because of all of you ma'am, Anuradha and Manisha ma'am and Swarnalata ma'am, you teach me. I can say only one word, that I can say that I am an Usmanian. I have done my DM from Usmania. I am Dr. Vani. I am a consultant nephrologist currently working at ANU Hospital, Vizag. I have done my MBBS from Guntur Medical College, 1995 batch, and MD General Medicine from Andhra Medical College, Visakhapatnam, and DM from Usmania. So actually we are 4 members from this area, Vizag, Vijayanagaram and Srikakulam. Dr. Ratnaprabha, Dr. Anita and Dr. Sarath Josna. Sarath Josna is working in KIMS from Srikakulam. Actually, they want to interact by themselves.
If you are there on board, I think they can just speak out few words.
Ma'am, so Sarath Josna madam, if they are online, they can talk to the audience. Ratna Prabha madam, Anita madam.
Dr. Ratna Prabha.
Very good evening, everybody. It's glad to be here this evening. Good evening, ma'am. Dr. Jikki ma'am, Dr. Anuradha ma'am, Manjusha ma'am, Manisha ma'am, Swarnalata ma'am, everybody. It's very glad and pleasure to hear all your views on this platform today. And many of you might not be knowing me. I'm Dr. Ratna Prabha. I did my MBBS and MD from Rangaraya Medical College. And then I finished my DM in nephrology in 2016 from Andhra Medical College. After that, I worked in Care Hospital for a couple of years, 2 years. And recently I joined as assistant professor in King George Hospital, Vizag. And I would like to express my thanks for giving this opportunity. And also this AP chapter, this WIN chapter in Vizag, I would like to express my willingness to Vani ma'am, whatever she comes forward to conduct CMEs and all, I will be there. And also after joining as assistant professor and the new responsibilities of teaching, improving the clinical services and the academic activities. And I think I will take them forward with the inspiration what all you have given to all of us. And thank you for being such an exemplary, doing such exemplary works in this field of nephrology, especially Manjusha ma'am, Manisha ma'am, Anuradha ma'am, Jikki ma'am, Swanlata ma'am. If at all I missed anybody's name, it's by mistake. And thank you all.
And anybody else would like to express? Like I could see few more names who have been, given their names that they would like to talk.
Sarat Jyotsna madam and Anita ma'am.
Yeah, I can see Sarat Jyotsna. You can please unmute yourself and start talking. Dr. Sarat Jyotsna.
Swarna, in the end, you give me a minute to talk.
Yes,
Not
ma'am.
now.
Yes, ma'am.
Good evening, respected professors, my seniors and my colleagues. And first of all, I would like to thank Swanlata madam, Manjusha madam, Manisha madam, and Anuradha madam, and Urmila madam for creating such a platform to give a continuing opportunity to learn something. And as madam said, we are all hesitant to involve in all these things because of the personal issues and clinics and busy work. But really, once again, I would like to thank everyone in the this organizing committee. And I did my MBBS. I am Dr. Sarat Jyotsna. I am working as nephrology in Government General Hospital, Srikakulam, and also as consultant nephrologist in KIMS Hospital, Srikakulam. I did my MBBS in Andhra Medical College, and I did my DM in Andhra Medical College. I did my MD in Usmania Medical College, and Manjusha madam being an inspiration to me to take up this nephrology branch. Though I am a gold medalist in neurology in MBBS, and I continuously used to think of being a neurologist, Manjusha madam Manisha madam and Sonlata madam, I changed my attitude towards nephrology. That's why I took nephrology as my branch, and definitely I will participate. As madam said, I will leave all my inhibitions and take the participation in all these activities, and whatever I can contribute to the well-being of the society, I will definitely do my best, ma'am. Thank you, ma'am. Thank you very much.
Yeah, thank you.
Anita madam.
Yeah, Anita, Dr. Anita.
Yeah, hi. Well, first of all, congratulations on starting this AP chapter. It's been, I've seen when growing within a year, if anybody can reach these heights, getting known internationally and nationally, the way you are growing is amazing. My congratulations to all the torch bearers. Why should I name Dr. Urmila? No, I don't want to name anyone. You 5 or 6 have really done tremendous job. You are an inspiration to our to the new the budding nephrologists, to all the students. And I'm trying here because of my illness. I was just laid back. Otherwise, we would have started a chapter here itself. But we'll do that. But I haven't seen anybody academic body growing so fast in a year's time, the way Win India has done. And my many congratulations to all of you. And we do hope that many more chapters will come up, and we will make more name the world over. No, thank you.
Madam, you equally are the part of the Win Leads. You have contributed significantly. We appreciate your monthly programs that are being conducted in association with us. So I'm sure you're one of us, and you're a role model too for all of us, for the younger generations. Of course, as you said, yes, we are scaling definitely a very steep heights. I'm sure we'll scale it further. Thanks, madam, for your wishes and all. And we are waiting a chapter from your state as well. So I think you should, yeah, madam.
I should have got it done by 15th, but I just came down with such a bad illness that I just can't stay up for a long time. I'm working short hours. So
sure, madam. We in future we want to see the chapter coming from your state as well. Thank you, madam. Thank you so much for the kind words.
Yeah, thank you, Anita. In fact, you are the inspiration for the Win India. So we have learned it from you only, madam. So,
thank you so much.
Yes. I would like to now request Rajiv Lochna. He's like one of the chairpersons for this topic. So I would like to
Manisha ma'am also.
Yeah, they have the Tamil Nadu chapter is very active and aggressive. In fact, we have thought of the state chapters only looking at the Tamil Nadu chapters. The purpose of inviting Rajiv Lochana is to, she can guide us to have the state chapters going on. So Dr. Rajiv Lochana, please.
Thank you, ma'am. And it's so nice to see all seniors. And actually, I think WIN India has shown such a phenomenal growth in the last 1 year. And it's such a pleasure to attend all the activities which go. I mean, it's really like it comes and all the activities are so up to date and practical for use in our setup. And it also inspires us because most of the times we feel we are juggling too much, or we don't have enough time, and actually that's not the truth because we see the others doing the same thing, and that's helpful. Regarding Tamil Nadu, actually, I think it started in 2017, and we had our first meeting sponsored by one of the pharmaceutical companies in Chennai. And Dr. Tamil Arasi ma'am, who was the ex-HOD of CMC Vellore, she actually traveled 3 hours from Vellore to come and attend it in Chennai. And that's what made it so good. And we had a talk that day, we had dinner together. And after that, subsequently, every 2 months, we were having regular meetings, in-person meetings. And each person was, initially it started with a very didactic talk, and then slowly went on to case presentations. And we had sessions where people were presenting their own cases or bringing in issues which they were facing a problem with, and it was really generous of all the seniors there to help us out whenever we had trouble. After COVID, I think the initial few months were kind of, no one could do anything much. And then after that, we started back the meetings. And currently, I think every second Tuesday or the first Tuesday, we are having a meeting every month on a virtual platform where we even have guest speakers coming in. Like, for example, next month, we have somebody speaking on ABO incompatible transplants. And to be very fair, all the seniors like Muthu Jayaraman ma'am are so sweet, and they really encourage all of us to kind of surface all our abilities as well as our concerns in how to move things forward. And the best part of it is they're all so humble in spite of so many achievements that they have done. And they call us if they need anything, and we can call them at any time if if we have any issues. And in fact, the best part is we've been even able to cross refer in terms of if we need something and some hospital has it and some doesn't. And it has been fairly a good amount of professional sort of growth due to this Tamil Nadu chapter. Recently, after the WIN India developed, Muthu ma'am was like, we should have some office bearers. So we did make like a Tamil Nadu chapter where we have a secretary, a joint secretary like the AP chapter now. And the only thing I would like to say is it should not become repetitive. We need to make it more vibrant so that the thing for it is not lost, and each and every person being able to contribute to it is the key, I think, to kind of keep it alive and vibrant.
Yeah, thank you, Rajiv Lochana, for your kind words and state chapters. So before we
Anuradha madam, Anuradha madam is waiting.
Last concluding remarks. So before that, I would like to.
Dr. Swanlata, before Dr. Anuradha speaks, I should get a chance to speak.
Yeah. I'm coming to that.
Because Dr. Anuradha's comments would be final. She is my mentor, teacher, guide. So she would definitely have the last word and the last laugh. But before that, I would also like to speak. So it's a pleasure seeing all of you here. I never knew so many beautiful women nephrologists are there in the twin states of twin Telugu states. I mean, I never imagined. So it's so nice to see all vibrant young faces here. Only bad thing is I'm feeling old now. I mean, that's the only bad part. But I mean, really excited to see all of you here. I firmly believe that women are amazing. They are beautiful. They are multitaskers, and we are perseverant. We handle the family well. We handle the husband well. We also handle our professional career as well. So I think all of us should learn from each other. All of us can learn from others. In fact, we draw a lot of inspiration from seniors. Dr. Manjusha is there. Dr. Swanlata is there. Both of them have been my immediate juniors, but very dynamic people. I have a lot to learn from my seniors as well. Dr. Anuradha is there, Dr. Urmila is there, Dr. Neela is there, Dr. Jiki is there, Dr. Hiteshi. Hiteshi was my immediate senior. I learned a lot from them. So what I believe is never say we can't do. We can balance, work-life balance is important, and we women can do it. Never think that you are outclassed or defeated. I always remember that if you think you are beaten, you are. If you think you dare not, you don't. If you like to win, but you think you can't, it's almost certain that you won't. Remember, sooner or later, who wins is the person who thinks he can or she can. So I think we are all in this together. We will take it forward. All other things have already been covered. Swanlata, Manjusha, all other WIN team have been doing a phenomenal, very excellent job. But from my side, I'm very interested, which the other societies in India have not done, is having multi-centric cohort studies and registries. So my passion is to start the registry. Shortly, you'll be getting a mail from WIN India. I request all of you to contribute your data there. The data entry platform is quite simple, very user-friendly. You can use it for getting your prescriptions, and at the same time, the data will be collected. And we have the policies where authorship policy is also established. You contribute, you have a publication. See, all the international publications are from groups. We can have a WIN group publication, which will be quite authentic. What is the point in having myself, unicentric study, everybody, each of us, they don't count anymore. Let us have multi-centric studies so we can go through that registry platform. This nobody in India has. This only happens if all of us are cohesive, all of us have trust in each other, and we work as a team. And I promise to take this forward with due credit to all who contribute. We have clear-cut policies as well. So let us all make this a reality. And with this platform, we can also have multi-centric cohort studies. Some of us may want to work on FSGS, others may want to work on IgA, somebody else on membranous. So simultaneously, we will have data entry from your institute, from her institute, from all the institutes, and we can have a longitudinal follow-up. So I see we have all heard publish or perish. And in India, the longitudinal data is limited. And we will focus on women-related issues. So that would be a huge data repository, and we will have multiple publications from WIN India itself. So my sincere, humble request to you, please, all of you, please join, contribute, and we will do what nobody else has done so far, at least in India. So I'm very sure we can take this forward, and I implore all of you to be a part of this registry. And it won't take much of your time. Never say no. There is time for everybody, for everything, for your family members, for everything. Do the best you can. Need not be perfect, but I guess we all should do the best we can. So just that promise we want from all of you. And let us show others that women don't fight. Women collaborate and move forward. So that's my message. And I hand over to Dr. Anuradha. Before that, probably WIN academic, we will have some non-academic WIN also, where we can focus on maybe finance management for a woman nephrologist, such things, keeping ourselves healthy, keeping ourselves glowing, fashion shows, probably in WIN India conference, I was suggesting to Swanlata, let us do something hatke, something different. Why not you people dress up in your dance dresses from your state? We compete with you, have a healthy challenge with each other, academic as well as non-academic. So that's my proposal to you. And over to you. And thank you, brilliant seniors. Thank you, enthusiastic juniors. You keep us always on our toes. Big thank you. I'm so happy to be a part of this family. Over to you, Dr. Anuradha, for your final comments. Thank you, ma'am. Thank you, Anuradha, madam, for the role model you have been in my life by being a mentor, teacher, philosopher, guide. Thank you very much.
Thank you, Manisha. I mean, I think a very great message you have given. And like you are the inspiration for all academics and talks that we have already heard. But what you don't know is you're also inspiration in your fashion technology. Just now you have mentioned. So don't bother that you're becoming old. So you're still still following in your fashion, trend. Okay. So I can see Kiranmai also. She can also express her, message in 1 or 2 words.
Oh, I didn't see Kiran May there. So just one last thing. Uttara has been a good influence. She's not senior to me. She is my parallel batch. And Dr. Kiran May is a very good friend. And I have great ambience in Osmania. Thank you, Kiran, for being there. I mean, really, you have been an excellent friend, and you help with whatever problem, and I have always a shoulder to lean on and share. So thank you very much for just being there.
Dr. Kiran, madam, you can please, you can share your thoughts.
Madam also speak. Let madam also speak.
Madam will have a conclusion and program will end with ultimate madam's message.
I'm very, very happy to be a part of such an inauguration.
Hello, Sanna.
Great beginning. Ma'am, please.
Madam, Meera Prasad, madam. Kiran, my man, go ahead.
Hello, everybody. Welcome to the AP chapter of the WIN. I'm very happy to see the inaugural program. So many emotional journeys have been unveiled. So many emotional words have been told. It's such a wonderful journey. Everybody have shared their experiences. Very happy to hear. Very happy to be part of such a program. Thank you, Swarna. Thank you, Manisha. And thank you, Manjusha. Thank you so much.
Yeah, Shiva Parvati, have we left anybody? Anybody would like to express among the juniors before we conclude Dr. Anuradha Madam's message?
I will go ahead with Anuradha ma'am.
Okay. Madam, now it's all stages yours, madam. People have been looking for your message. So the program begins with you and ends with you. So please, madam, we are all waiting for your message. Anuradha madam, please.
No, Swarna. Good evening, everyone. I don't think I need to be really shown in that height as you always talk about me, but it's really heartening to see so many youngsters so vibrant, and I echo most of what Manisha has said, but the only thing I would differ, I can't talk the way she talks. Probably, she's more enthusiastic, more vibrant than I am, but I differ in one aspect. She said, I feel sad that I feel old. I don't feel old. At 70 plus, I don't feel old, Manisha. I still feel, because I personally feel age is just a number. It's the spirit in you, within you, that should make you feel as young as you possibly can. I still feel very young. I still feel I have a lot to do. I feel that I feel only sorry that I am not younger in age. Probably I won't live as long as you people would, to do as much as I would want to do. But I have a great feeling, a solace, that there are many, many youngsters. I don't really feel that I have done enough, but with the way everybody has shown enthusiasm to take this WIN India for, it's wonderful to have started the WIN India. And to that, I would definitely, the credit should go to Professor Vidyacharya, who kept on telling us that we should form a WIN India, and today it has become a reality. It has gone to every state. We started with WIN India. Now we have a WIN in so many states, and today WIN AP, which is a sister concern of ours. We were a combined state, and most of our work in our days was in AP, combined AP. So it's very, very heartening to see WIN AP being formed, and we are a part of it. We are always with you, and whatever help you need, wherever you need our support, we are always there. And again, my interest is in forming registries. Yes, because way back we started the CKD registry, but we only had a horizontal data, and it sort of died there, and that should not happen. We should have longitudinal data. We should have a good follow-up. We should know what is happening to our patients, what we can do further to to decrease to sort of delay the progression of the disease. So that only will come with our data, and in the formation of data and in contributing to this registries, I know Manisha is excellent and she will do a wonderful job. And to contribute, what is important is in your small way, even from the smallest of centers, you can get data, and this will make a big difference in your final analysis. So I would urge each one of you to contribute to the registries that Manisha is proposing. It's, of course, when it has, Swarna has been a live wire here. Her organizational capacities are exceptional. Urmila, Manjusha, Manisha, they are probably the 4 pillars on whom when Telangana is resting. And like similar way, I think Jikki being the main center, when AP will also move forward. My best wishes are always with you all. My support is always there. You can live up to my support in whatever capacity I can contribute. Wish you all the best.
Thank you, madam.
Madam, as president, I would like to talk.
Yes, ma'am. Please go ahead.
Yeah. As a president and from the other council members of AP, we would definitely go through this registry, and it's a promise. And this would help us all over India to come across in the same platform. And this we will carry on, ma'am. And thank you all.
Thank you so much, madam. Dr. Shiva Parvati, before you give the final comments, there's the little clarifications which I would like to make on behalf of Win India is that, see, you can become a member of Win India by just going to the website. It's a free membership as of now, but we are planning to make it little paid membership in a short time. So please, the Win AP members, if you're not yet registered for the Win India, please register yourself. Second part of it is the Win icon. If you want to register, which we are requesting you to register because we have excellent scientific program that's coming up, please register by going to the website I'll post in the chat box. Please go to the website, register yourself, but you need to pay money for the conference. So these are the 2 things. Please become member of Win India. It's a free membership. All of you are requested, please pass on the word in your groups. And as far as the work-life balance, which Manisha was speaking about, if you're already on Twitter, we have a Win India tweet chat, which is coming up in the last week of June. Please join the tweet chat so that you can share all your experiences, incredible journeys in the tweet chat. So it is taken in a wise. So membership, please, it's a free as of now. Please join. And Win icon, please register yourself by paying. For trains about 1,000 bucks, 1,000 INR, and for faculty it's about 1,500 rupees. And it's early bird till June 30th. Subsequently, everybody to register for. What you, Shiva Parvati?
Thank you, ma'am. And I think it's a wonderful session, though we have passed 30 minutes 9, but we're all very active and energetic and enthusiastic to listen from all.
Sorry to disturb you, Shiva Parvati. See, Win icon, let me explain. Win icon stands for Win India Conference, which is a national conference. This is the first annual chapter we are conducting on behalf of Win India. So the venue is in Hyderabad, Nizam's Institute of Medical Sciences auditorium, which we're bringing in so that it's a cooler platform, comfortable platform for everyone. So this is on second Saturday and Sunday of August. So you are all requested to join, and the registration is also very minimal payment. Thank you. Over to you, Shiva Parvati.
Just one point I would like to ask. Shiva Parvati, one point I would like to ask Dr. Manisha. Regarding the register, what register you're talking about?
Uttara, what I'll do is, like, we'll be sharing a link soon where we have made a platform, data entry platform, where you can contribute data from each of your centers. And we
What data? What data? What type of data?
Everything. So the platform works like that you'll be able to enter.
It's not possible. How you?
Uttara, I've been working on this for almost a year. Okay. So don't worry. If you have
data entry,
I think such queries should not. I mean, this is now. It's not the time to
Yeah, we will
There are
explain to
certain
you in
queries.
another
You
one.
can have it later.
Session. I think we can have a
Positive,
separate session for
be
this.
positive, move forward. You want results, the results will be there. Don't worry. See, I've thought all about all of that and come up with
Be
this.
specific what
Don't
you
worry.
data.
We
That
have
will
a
be
separate
better.
session for
Sorry
this.
to interrupt, Swarnalata, Uttara, and
Yeah, we'll
this
have a
platform is to discuss the Win AP and Win India. And the discussion further regarding registry, Manisha has already conducted one demo platform on behalf of Win India. Manisha is again planning to conduct another session. Do not miss it. And if
For
anything is there,
everyone.
we'll further discuss in subsequent meets. Over to you, Shiva Parvati, for conclusion.
Ma'am, and I think if there are no question and answers, so we will close this session. And I would like to tell the vote of thanks. I think the first person to be thanked for is Dr. Swarnalata ma'am, because she's been after me and all the members to fix a day, to talk to everybody, and to fix the council members, without whom I would not have done this. And next, coming to my senior, all my teachers, really I'm very happy to see all my teachers, Anuradha ma'am, Manisha. Anuradha ma'am, I used to see her in forums. Everybody used to be afraid what question madam will ask to me. They all, they all frightened me like anything. Today you're going to present before Anuradha madam, you are over. But I felt so happy the way she explained after asking the question. When we were not able to tell, she used to explain very nicely. So I remember those days, ma'am. Anuradha ma'am, Manisha ma'am, Manjusha ma'am, and Uttara ma'am, all the other from other states, Muthu Jayaraman ma'am, who has participated, and Srilata ma'am, and Rajiv Lochna ma'am, and senior members from my state, Uttara ma'am, Hitaishi madam, who has been continuously guiding me to talk with the juniors, to talk with the seniors whom I don't know. She has made me connect with them and know about them. And for all my colleagues from Visakhapatnam who have spoken over here, and all the technical staff also for helping me out to carry on this meeting in a wonderful way. And I think with all the support that the seniors have given us, especially Dr. Jiki madam, I'm really moved actually how she told with the child, she studied DM, because when I joined my DM, my son was 6 months. I felt I was doing something great, but now I came to know everybody has passed that stage, and it's really happy ma'am. With under her leadership, definitely AP Win India is going to rock, and that's why we have formed a cultural committee also, ma'am, Manisha ma'am, so that we can plan music, dance, and everything. And with this note, to start this cultural meeting, I'm taking initiative from myself. So we will thank Lord Venkateshwara as I am from Temple City. I would just like to sing one line of Annamacharya Kirtana and end this show. Narayana te namo namo, Narayana te namo namo, Narayana te namo namo, Bhava Narada Sannuta namo namo, Narayana te namo namo. Om Namo Venkateshaya. Thank you so much, and I thank the Almighty for helping us to be hale and healthy, and we'll take this with India in a greater way. Thank you so much. I think Swarna ma'am, can we leave the webinar?
Yes, yes.
My teacher.
We have paid the God also, so that's the final. So we all leave. Thank you.
Thank you.
Good night, everyone.
Good night, ma'am. Good night, ma'am. Happy to see you.
Good night, everyone.
This is one meeting where we exceeded the time, but none of us realized it. So great. I mean, not boring at all. Fantastic. Thank you. Wow. Amazing. Thank you.
Thank you so much, ma'am.
If I am permitted, I want to put one word.
Yes, madam.
Yes,
Yes, madam. Please go ahead, madam. Please go ahead, madam.
We are calling ourselves women of India, so we should represent Indian culture. That is where at least sari on this day, on this conference, I want to see all of you in sari. This is what I have done when I used to go to international meetings. Compulsorily, I used to wear sari so that they know I am Indian woman. So at least for this meet, Women India, please wear one saree, and I can also see all the designer sarees and whatnot, all new things are coming.
Yes, madam, I always do that, so it's for the others to follow.
Also remember that we are women and we should enjoy the femininity in us, that is wear some matching jewelry, costume jewelry, wear
Sure,
some
ma'am.
carry and come. I'll appreciate that very much. And one more thing I want to add, Dr. Bharti said she wants to do clinical nephrology. I think that is a very good idea. When I came back from CMC Vellore after doing nephrology, I used to see a lot of chronic kidney diseases, and that time I had no dialysis. So I used to put them on follow-ups, 3 months follow-up, 1 month follow-up like that. And that data showed that it is a nephrologist who has to follow the kidney disease, not a physician, general physician. So I like all my juniors to follow the chronic kidney disease patients and make them happy. Make them happy. They don't need dialysis. Just make them happy. And please wear nice designer sarees. Put matching costume jewelry and come. Thank you all. Thank you, Sina, for a wonderful speech.
Thank you, madam. As a woman, we are fortunate to women, wear whatever we wish to. And I think wear sarees, women, and try to, take our culture and tradition forward. Thank you, man. Thank you for your message.
Well said, Sanlata. So Win Icon promises to be a conference of great academic session, of dedication, passion, and fashion as well. So we'll have a gala time, great time. Thank you very much.
Good night, all.
Good night, ma'am. Good night to all. Thank you, ma'am.
Good night.
Good night, and wish you to, I wish to see you all in the next AP chapter. Thank you.
Yes, ma'am. Thank you, ma'am.